basic anatomy of the spine there. Any questions on anatomy? Lots of muscles. You got little muscles, you got big muscles going along your spine, along your hips, crossing your pelvis, crossing your sacrum. All good stuff. Of course, all good stuff that can be turned into bad stuff, unfortunately. Okay, so what causes back pain? Lots of stuff causes back pain. We'll go through kind of the top causes though. Sitting is a huge one. If you've ever read, I guess, any of my emails or blogs on back pain, or just read about it in general, got you all these nice hard chairs for this presentation, so feel free to stand up and move around. But prolonged sitting especially is a really big issue with back pain, mainly because of the compression, the sustained compression. Interestingly enough, sometimes it feels good to sit if you have back pain, but then usually it doesn't feel good to stand back up. So it might feel good for a short while and you gotta stand. So that's a big cause of back pain. The wrong type of exercise, we're going to talk about that a little more later. But basically, depending on the type of back pain you have, there's good exercises and bad. So good movements that can help correct your pain, and on the other side of the spectrum, just the opposite movements will make your pain worse. And nowadays with things like YouTube and Google, it's really easy to just say, oh, let's just check out some exercises and apply these to my back pain. If you don't know what type of back pain you have, it's really easy to mess up on that and do the wrong type. Postural changes, that goes into sitting as well, but standing postural changes as well. Just changes in your back, and that can affect muscle imbalances and stuff like that as well. So, you know, your mom always told you to stand up straight. And in PT school, they always told me that because I'm quite a sloucher. I still kind of am a little bit of a sloucher, but I'm trying. You got to practice what you preach. So that can cause back pain as well, though. And the big reason that would cause a change in your back pain is that when your posture changes, all of the forces throughout your spine, be it the forces through those discs, the forces through the joints, or the stretch or the contraction of the muscles, it all changes. And over 20, 30, 40 years, those changes that were reversible at first are now becoming more sustained. And so you really got to watch those things going forward. Those are big causes of back pain. So we're going to break back pain into 4 types of back pain, basically. We're going to talk about SI joint dysfunction, which we'll get into in just a minute here. Sciatica, which is a big one for a lot of people. Muscular pain. And then we'll talk about the degenerative types of pain, so the discs and the joints degenerating. So SI joint dysfunction first. The SI joints are those joints where your pelvis meets your sacrum. So it's sacroiliac. You don't necessarily need to know that. But that's where your sacrum fits in here with those little bones. For most folks, it's like 2 little dimples on the back of their spine. So if you feel along your pelvis, you'll feel that. This type of pain is, depending on who you talk to, this type of pain is super common or it's not common at all. I think from most of our perspectives in PT, it's quite common. It's just a matter of what's causing it, and if you need to treat that or if you need to treat the underlying cause. So here are some common signs of SI joint pain. A lot of times you've got difficulty putting your socks and shoes on, bending forward. Typically pretty stiff getting out of bed in the morning. Sitting and standing can increase pain, especially sitting for people with SI joint pain. They tend to sit like way off to one side to kind of like space out one of the joints. The nice thing with SI joint pain, not nice, but if you have it, it typically is fairly localized. So you can typically go, I hurt right there. And it doesn't usually radiate down your leg. It can cause sciatica, but not super common unless there's just a bunch of irritation all around it. So it's somewhat easy to diagnose, not all that easy to treat because there's weird things that go on with your sacroiliac joints.
Luke?
Yeah.
Can that, you say it doesn't cause sciatica, can it go anywhere else?
Well, it can cause sciatica. There's enough irritation.
Okay.
Typically it doesn't, it's not too, yes it could cause other pain. Usually it's because it's either caused by another type of pain or it is causing another type of pain. So it usually, the SI joint pain itself typically stays right there. But if you've got that pain because of you've got a couple locked joints or you've got some tight muscle imbalances, you typically have more types of pain. You just don't typically get a ton of pain down your leg, but it can cause it.
No, I wasn't thinking down the leg. I was thinking more localized in that area.
Definitely. One thing to keep in mind too as we go through is you say, well, what type of, the 4 common types of back pain, which one do I have? It'd be nice if you just had one, but it's possible you have 2. Sometimes if you're unlucky, you might have 3. You have to kind of ferret out which one is causing this or which one's causing that. So that's my use of the word ferret for the day. Once a day is recommended. Okay. So here's some issues again with SI joint dysfunction. A lot of times, like I was just mentioning, you've got joints in the lower back that are stiff, or they're kind of locked up. And so what you'll get then is any of that movement or the force that should be going through those joints will then shift down the chain and then end up causing movement or irritation at those SI joints. The SI joints are kind of funky, like I mentioned. They're actually not like a smooth joint. You think of a joint like hinging and unhinging, or maybe a smooth surface, like a rounded surface and a concave surface. The SI joints are like this. They're like a bunch of rocks and just scraggly. And so it's, to have the force transmitted through there and just kind of rubbing those weird areas against each other can cause a lot of irritation. Oftentimes, again, the back is very stiff. And what we'll see, sorry, it's a little blurry in the bottom there, what we'll see sometimes is that you will see the SI joints will actually shift. So the pelvis, again, is two halves. It can rotate. So you'll see your nipples on the back will be in different spots, or you could have like a shift of your pelvis. A lot of times that goes with like a leg length discrepancy if you have one. So you might see someone, this is a good common one after like a hip replacement. And hip replacements, they do their best to make your legs equal. But has anyone here had a hip replacement? Or known somebody? Oh, Jerry, you had one? Yeah.
I had
Two, yeah. Did you notice any difference in your leg lengths afterwards at all? No? Good. My brother had one at 32, unfortunately, and his new leg, is it shorter than the old one?
It's longer.
Longer?
Yeah.
It's a good inch and a half longer, though. That's
Well,
not
it might
super
be,
common with a total hip, but
It might be as much as an eighth of an inch, if that, but they used a laser when they
Oh,
replaced
yeah.
mine.
you had one of the newer ones. Yeah. Yeah, and so the surgeons are very careful about that, but it's not an exact science when they do that, so you will get people who have a good inch off, and that can just really change the alignment of those joints. Another common one is anyone with like a real bad knee, total knee, stuff like that. So if your knee is really arthritic, a lot of times you can't straighten it, and so what will happen over time is that leg will be shorter functionally, and that could be for years. And then you come out of surgery or whatever, and we talk to people about the knee pain. They say, "Hey, do you have back pain by any chance?" I'll go, "Oh yeah, I have back pain." Or Susan, you're sporting a walking boot today.
Yeah, I am.
If you don't match that walking boot, which has a thick sole on it, with another thick-soled boot, do you notice it?
Yep.
Yeah, big time.
I'm about as matched as I can get, and my SI joints and
Yeah.
piriformis muscle, they're all screaming.
Yeah. So you see someone come in like a walking boot, and those walking boots, the sole on them is like that thick, and they're wearing their tennis shoe, which is like that. So all of a sudden they created a leg length discrepancy. So we always say, "Hey, how's your back doing?" Like, "Oh God, it's horrible. I'm coming to PT for my ankle, and my back is just killing me." So we'll try to help them out. Something like that, if it's temporary, you can just use like a leg lift or a heel lift. So some of it's easy solutions, and some of it's not. Cool. So that's SI joints. Sciatica is a big one. Raise the hands. People with sciatica. Yeah. Okay. That's a fun one, right? So you already know this pain. Pain down the back of the leg is real common. You can get numbness and tingling, pins and needles as low as the feet. This is an interesting one to talk about with where do you hurt. So if you have sciatica that's related to a disc bulge, typically you're going to feel worse if you bend forward, because it's going to push the disc back farther towards those vertebrae. If you have sciatica more from a chronic stenosis or narrowing of the spine, or like a compressive force on the spine, typically bending forward actually feels good, and bending backwards feels worse. So that goes back to what's causing your pain, and which exercises work based on the cause. Because if we gave back bending exercises to a person who has for everyone who came in with sciatica, half people would probably feel better, half people would feel worse. So you've just got to know what you're dealing with. Again, you can get pain all the way down the leg. A lot of people will get sciatica just into the buttocks. The next step is kind of like back of the knee. And then if you've got a severe sciatica, it's all the way down the leg.
When I notice, like, when I go with my boyfriend to the west side, if I sit in the car, my leg still gets the pain down the back, and it really hurts. I don't get it so much standing up anymore. Why
Yeah.
is that?
you probably have more of the compressive pain because as you're sitting, your spine is compressing. And actually, when you sit, you have a lot more pressure on your spine than when you stand and walk. It doesn't really make sense that much because when you sit, your spine is still
Because
vertical.
even right here, it hurts.
Even in your hip and groin. Yeah.
Well, like just right here.
Yeah. Yeah, and I'll get to some pain distribution patterns here in just a minute too. But a true sciatica, irritation of that sciatic nerve, which is that big nerve that runs all the way down the back of your leg through your buttocks, it's about as thick as your thumb. It's down the back of the leg. If you have numbness, tingling, symptoms up higher,
I have it
usually
in my
it's-
thigh.
Yeah, usually that's higher up in the back, so it's not quite as low as the sciatic nerve. Or if you have pain in the groin, that can be more like hip joint pain.